Good afternoon, everyone. Thank you so much. Welcome to those who are here in person and those online. Thank you so much for coming to our noon seminar. We are extremely excited to have guests from the CDC today. I'm going to turn it over to Emily Young, who co-leads the Departmental Student Association, to introduce our guests.
Thanks, Terry. Hi, everybody. For those who don't know me, I'm Emily Young. I'm a second-year doctoral student in the department, and as mentioned, one of our 4 DSA representatives this year. We had the opportunity to organize this week's seminar and are really excited to have 2 speakers from CDC's Division of Adolescent and School Health joining us today. Our first speaker is Dr. Leigh Szucs, who is, I've been fortunate enough to call a mentor and colleague the past few years. She is a health scientist at CDC, and her research focuses on implementation and evaluation of school-based health education programming, specifically sexual health education in US schools. And she also provides technical assistance and capacity building assistance to school districts across the US who are working on implementing more inclusive and comprehensive sexual health education across grades K through 12. We are also joined by Nick Suarez, who is also a health scientist at CDC and another dear friend and colleague. Nick focuses mostly on program evaluation, working with CDC-funded school districts to evaluate the implementation of different sexual health programming in schools. His research interests are in school-based strategies to support transgender and gender nonconforming youth, intersectional approaches to inclusivity practices, and strategies to foster acceptance and support among parents of LGBTQ youth. He earned his MPH at the University of Michigan, and I'm saying that because I know that the Michigan family is strong, so they would all want to know. So that being said, Leigh and Nick, I am passing you the baton, and you can take it from here.
Awesome. Thank you so much for that introduction, Emily. I feel like, it's like coming home. We just had a meeting this morning. And so, for myself, I'm just so excited and grateful to have been asked to participate in today's session, and really excited and grateful for folks on the phone and in the room. So as Emily said, I'm Leigh. I'll be co-presenting with Nick on a portfolio of work that is near and dear to our hearts as scientists, but also a priority for the Division of Adolescent and School Health within CDC in terms of advancing all of our school-based strategies and ensuring that they are both inclusive, comprehensive, and really serve to affirm students with LGBTQ plus identities. So Nick, any intro comments before we jump in?
I think you covered it, but just again, thank you all for having us. We're really looking forward to sharing our work and taking your questions after.
Awesome. So the name of our talk is Advancing Inclusivity for Students with LGBTQ Identities Through School-Based Approaches. And for bandwidth issues, Nick and I are going to jump off camera while we present, but we're happy to come back on for the Q&A. And please keep the questions till the end. All right, so to get started quickly, we want to acknowledge some of our key and super important team members that contribute to this body of work. Others within CDC-DASH, we want to acknowledge and lift up our colleagues at ICF, which is the contracting firm that has helped with one of the projects that we're going to be highlighting today, specifically the Toolkit project. And as part of that work, also want to lift up the program staff at the 3 school districts that we currently are working and piloting with. None of the work that we're going to talk about today, and specifically none of this toolkit work, would be possible without folks across all these 3 groups. And to provide the disclaimer. So how we're going to spend the time together today, we're going to move relatively quickly because we do want to hold enough time and space for questions. So I'll talk a little bit briefly about the Division of Adolescent and School Health. I think Emily teed it up nicely, but just to talk a little bit more about who we are and what we do. We'll spend the majority of the time talking about the inclusivity portfolio, and we'll speak on data, research and evaluation, programmatic activities, and then mostly about one of our research demonstration projects that's titled The Roadmap to Inclusion. We'll end the presentation with just a few key resources for schools. Hopefully some of these will be familiar. If not, we'll be excited to highlight and point folks on the room and on the phone to some key resources that might be helpful to you in your work. And then we'll end with question and answer. So really briefly, we wanted to just start by kind of grounding in the key functions of what we do here in CDC-DASH and how that's related to public health prevention approaches. And so for us, the work really cuts into 3 buckets. So one of the core functions being collect and analyze information, right, about adolescent behaviors, as well as school health policies and practices. And that data collection and analysis is done primarily through 2 of our major surveillance systems. So the Youth Risk Behavioral Surveillance System, or YRBSS, and school health profiles, known as profiles. In addition to the data collection and kind of moving beyond just tracking and surveilling adolescent behaviors and health, and school health practices and policies, a large bit of the DASH portfolio is focused on research and evaluation. And that includes understanding and conducting research on CDC-funded programs, so school districts, NGOs, or other community entities, while also focusing on identifying emerging health issues, new innovations, new interventions that are happening in the field, in schools, again, all to address adolescent health behavior as well as policies and practices. And then the third core function that we perform here in DASH is to support and implement primary prevention of HIV, STD, and unintended pregnancy through effective and promising school-based programs. And so that third piece really being the programmatic support and the implementation of comprehensive programming through schools. And it's worth noting that none of these core functions can be done without the really substantial grounding in partnership. And so that undercuts all of the work that we do. DASH is a relatively small division. We're less than 100 people. And so we rely heavily on partnerships, both within the agency and really importantly outside, across states, territories, local education agencies, community organizations, non-governmental entities to advance work in these 3 core functions. So really quickly, when we talk about kind of the programmatic work or the programmatic approach, we think it's always helpful to kind of show a visual of what we mean by the CDC-DASH approach to school-based primary prevention. And so kind of reading from left to right, as you can think about this as, a little bit like a mini logic model, but we in DASH provide 3 primary inputs for the programmatic work. So that includes funding for a staff person or persons and a set of implementation activities. There is an input support around from NGOs, from a network of national non-governmental organizations, as well as supports provided or input from a CDC technical assistance infrastructure. And so those inputs go directly to local education agencies or school districts. And, interestingly, DASH is the only place in the CDC agency that fund directly to the local education agency level. And so that funding provides an opportunity and an environment where we have a champion leader, a doer, as you can see kind of in the middle of the graphic. That person or persons helps to coordinate and facilitate a set of implementation activities across schools. And we have 3 primary strategies or areas of implementation activity, and those fall under increasing quality sexual health education, providing linkages or provision of health services for students, as well as fostering and creating safe and supportive environments. And it's, the synergy of those strategies that we, through our research and evaluation data, have been able to show impacts and changes in adolescent health outcomes. And so for us, some of those include decreases in sexual risk, decreases in substance use misuse, increases or improvements in mental and emotional health, decreases in suicide, as well as experiences of violence. And while, all of the strategies, the sexual health, the linkages to services, and the safe and supportive environments all have components and pieces of LGBT inclusivity. I think that the majority of the work around inclusivity for students with LGBTQ identities falls within that safe and supportive environments domain or set of implementation activities. So we'll really kind of be focusing there for the purposes of today's talk. The last thing, just to orient folks to kind of DASH, you might be thinking, okay, we have this program model, we have the core functions. Who is it that actually receives federal funding from your office? And so you can see here in the map, we fund a number of different places across the United States. Those that include state education agencies in the kind of light blue, state health departments in the green, tribal education agencies in that purple, as well as the star being the tribal nation in Oklahoma, and then a number of local education agencies with the black dots. So we have representation, you know, all across the United States for both surveillance related activities and our programmatic strategies and activities. And with that, I'm going to turn it over to Nick to provide an overview of the LGBT inclusivity portfolio.
Thank you. Yes, so just diving into our LGBTQ inclusivity work, I want to start with highlighting a little bit of the research that we've done using the YRBS and the school health profiles. And so this was published this past year, actually, by a colleague of ours. Who's no longer in DASH, who's now in injury prevention. But looking at the YRBS, so the student risk data, and coupled with school health profiles data of policies and practices at the school level, we actually found that schools that implemented more of these LGBTQ inclusivity practices that we promote in DASH, there were population level reductions in risk that applied for LGBT students, lesbian, gay, bisexual students, and heterosexual students, where we found decreases in sexual risk behavior. We found decreases in risk of suicide, decreases in likeliness to use drugs, and increases in feeling safer in school, which to us really kind of demonstrates the potential of these inclusivity practices to improve health, not just among LGBT youth who are, you know, disproportionately feeling the impact of these health risks and these disparities, but also just it creates better, more supportive environments across the school population. Next slide, please. And so this is also supplemented by other CDC reports that we've published just using the YRBS data, where we really kind of describe these health disparities, both among sexual minority youth, so lesbian, gay, bisexual, using our nationally representative YRBS data, but also among transgender youth, using our state and local urban school district data. And I will say, just as a little plug, we have not had nationally representative data among transgender youth to date. It's not been something that's collected in the YRBS. However, starting with the 2023 cycle, we will now begin collecting gender identity. So we'll also be able to kind of add to this research base nationally representative estimates of these disparities experienced both by LGBT students and as well as transgender students. And it's kind of been an iterative process. You know, we're also this current cycle increasing our ability to identify students who identify with some other sexual identity that's not just lesbian, gay, and bisexual, being able to kind of tease out more of the questioning youth, other identities, and those who just don't understand the question. So just little tidbits, you know, we're constantly improving our surveillance and trying to better characterize the experiences of youth in the United States. And next slide, please. And so that brings us to kind of our broad inclusivity portfolio. So as I mentioned on the research and evaluation side, we do have these reports looking at the YRBS at risk behaviors among transgender youth and among LGBT youth. And we've also seen these school-wide benefits of inclusivity across the psychosocial and sexual health outcomes. Of note, that paper really, or that set of papers really spurred additional research projects where we're kind of going to be diving deeper into the why are we seeing these school-wide benefits across heterosexual students as well and cisgender students as well. And so that's kind of some more research that we're diving into to have better guidance in the future for how do schools implement these strategies. And then bolded there at the bottom is the development of this school district LGBTQ inclusivity toolkit, which is really kind of the focus of our talk today. And then across our programmatic activities, a lot of what we support or what we, what we recommend schools to implement is implementing and expanding GSAs in their schools. So that's gender and sexuality alliances, also known as gay straight alliances. These are really student-led clubs for being able to just support, discuss, learn more about gender, about sexuality. And so that's kind of a big pillar of our inclusivity programmatic activities with our kind of main dash funding. And then we also recommend and promote professional development for school staff and district staff to address classroom management and to support students with LGBTQ identities, things like using inclusive language, supporting transgender youth, right? Just sorts of things that kind of might be determined at the local level, but broadly providing that professional development for districts to be able to be better equipped to support LGBTQ youth. And then across the technical assistance side, we also frequently collaborate with our NGO partners in providing technical assistance to our funded districts. And this includes on implementing LGBTQ supportive practices, as well as developing resources for districts kind of in tandem with the research that we're conducting, and developing tools and resources. And next slide, please. So that brings us to kind of the main topic of discussion today, being the roadmap to inclusion, and making schools safe and affirming for students with LGBTQ identities. So the research is pretty clear that LGBTQ students benefit from inclusive schools. We know that there's these health disparities, but we know when schools are welcoming and safe and affirming, that can really be a protective factor for LGBTQ youth. While we know this, we also can look at the profiles data and we can see quite a large amount of variation in the implementation of inclusivity activities across schools and across school districts in the nation. So if you look at this figure, this is really showing the percentage of schools that have kind of these different inclusivity activities in place. And it's nearly universal that they prohibit harassment based on sexual orientation and gender identity. But then all the way at the bottom, we have gay straight alliance or gender and sexuality alliances, those clubs, and the lead health education teacher receiving professional development on supporting LGBT students, quite at the bottom, quite low, around 40% across schools. And so that's kind of a big gap for us that we want to create this toolkit so that, you know, we can help diffuse these strategies across school districts across the nation. Next slide, please. And so the purpose for this toolkit is to develop and pilot test a toolkit to serve as a resource for school districts seeking to increase inclusivity and safety for students with LGBTQ identities. So to go about creating this toolkit, we entered into this 4-phase project where we have kind of formative research to ground where we're going with this. And then based on that formative research, develop a toolkit, then pilot test it, and then finally evaluate and refine for future iterations. So to begin with the formative research, we started by looking to assess the existing guidance, what's already out there, what are the policies and the programs that are in place and resources for LGBTQ inclusivities in schools. To identify this, we conducted a literature search and an internet search looking for web-based resources. And so this included things like district and school level guidance, guidance for implementing GSA clubs, sometimes population-specific guidance, such as supporting transgender students in school in particular, guidance on using inclusive language and resources for inclusive language in school, and resources around adolescent developments, in particular around sexual identity and gender identity development. And then, of course, we fund several school districts around the nation that are already doing this work, that have been doing this work. And so another key piece of this formative research was having this key informant interviews with our funded school districts. These are districts that have been involved in creating and implementing innovative, safe and supportive environment strategies. And so that was another really key way for us to understand what's going on the ground, kind of day to day. And so then moving into the toolkit development phase, we start with describing the evidence, the why for LGBTQ inclusivity in schools. And this is really important for us as a scientific organization to make sure that we're leading with the evidence, with the science. And this is where we can really demonstrate both the undue hardship that are faced by LGBTQ people, LGBTQ youth in the nation, as well as the potential for schools to create welcoming and protective environments. And then we also wanted to include resource in the toolkit for school districts that are newer to this work. We want this to be a resource that can be both a starting place for these new school districts, as well as new ideas for districts that have been doing the work already. And so this sort of before you begin primer is a way that we can help focus on how to build individual background knowledge on LGBTQ inclusivity, diffusing kind of introductory professional development across their school district teams, introductory to LGBTQ inclusivity, and engaging a diverse district team with people with various roles and kind of trying to make this more of a district-wide effort, and setting priorities and realistic expectations, knowing that, you know, if you're new to this, especially, you're not going to be able to kind of do everything, and there's going to be some roadblocks along the way. So how do we kind of create some more creative solutions to advance the work, even amidst some of these roadblocks? And then we also are including appendices in the toolkit, one being a district assessment, and that kind of being the starting place for the intended starting place for all of the school districts, so they can really get at a glance look at where their district lies with respect to inclusivity across these different domains in the toolkit, and kind of help some more of the action planning process. We also include staff training resources, in particular a national network of NGOs that can provide assistance and professional development. And we also have an appendix in there about how to use data to really support LGBTQ inclusivity and kind of drive the message home as why it's needed. And so then that brings us to these 6 practice areas of focus, being policy implementation, professional development, programs, district and school environment, partnership, and evaluation. And these practice areas are based on the needs and the gaps that are identified in the formative phase, and kind of have some more practical suggestions and ideas for implementation at the school and district level. And then I will turn it back to Leigh for the pilot testing.
Thanks, Nick. So we are now going to move into where we currently are, right, as of today, on the pilot testing or phase 3 of the toolkit project. So currently we are working with 3 districts, large urban school districts across the South United States. And those districts were selected through a recruitment process that involved both, staff from our team as well as ICF, conducting evaluability assessments, trying to understand what was the current landscape in those areas of focus around LGBT inclusivity. And we made some selections and refinement to land on our 3. And within those 3 different districts, they have varied experience with LGBT inclusivity practices. Some of them have been doing this work for many years. Some of them are newer to the work. All of the school districts bring expertise to the table at various stages or capacity levels. And so that was really important to us in terms of thinking about recruitment for this toolkit project was we were intentionally looking for sites that were kind of all across the board, and had expressed diversity in all different ways. So student population, community characteristics, staff expertise and knowledge, challenge, perceived barriers. And so, also the other thing that was really important to us in thinking about recruitment and selection for the school districts to participate in the pilot was the location in the US, right? So typically in some of our dash work, we tend to see that school districts along the coast, right, maybe further along or have more advanced strategies, and that oftentimes we have to be really intentional, and it's an important aspect to try to recruit from the southern region of the US, because we know students there are facing disproportionate risks and burdens, especially for students with LGBTQ identities. And so we were really excited when we had some expressed interest, and then we're able to select those school districts from the southern part of the US. So we're in the pilot phase. We're working with our school districts. They have, they're starting to receive components of the toolkit, as Nick just talked about. The district assessment is really the first step in this process. And so we're excited that our districts are actively working through the assessment process. They've created these kind of multidisciplinary teams, and they are doing the district assessment, having conversations, identifying and creating action plans that they will use to guide their work over the rest of this fall semester, but really into the spring and ending at the end of this academic year. And so phase 4 of this work, as you can probably imagine, is evaluation and refinement of the toolkit. So we started with those formative questions we've developed, we're pilot testing, and then we really want to know, did this work? What was successful? What wasn't successful? And then what future refinements can we make to the toolkit itself? So as part of this phase 4 evaluation, we have a number of different data collection activities that are part of this project. And so you'll see there at the top, the first is a set of school climate interviews with school and district level staff. And so those baseline climate interviews were conducted this past spring, again, to understand staff's perceptions, experiences of climate and inclusivity in and across the district and schools. And we have a planned post-pilot follow-up data collection in the spring of 2023. We also, in addition to the qualitative interviews, will be doing, and we just launched in the last week, actually, the school climate surveys with staff. So again, as a way, and from this mixed methods perspective, really being able to dig in the interviews on climate, as well as provide those kind of quantitative findings from staff surveys. Again, in the last week, we just started piloting those surveys with staff in our participating districts, and similar to the interviews, we'll do post follow-up in the spring of 23. And then the third primary data collection strategy is a monthly LGBTQ inclusivity tracking report. And so what that collection will help us to understand is what was the process and how did the toolkit actually get implemented, right, on a monthly basis? So were they providing trainings? How often were they talking with staff? Were they doing policy analyses, or kind of that process, that implementation data across the months to be able to inform our understanding of usability, feasibility, and kind of how the toolkit worked in real life and in almost real time. So that monthly tracking is the third piece of data that will be collected as a result of this pilot project. So then, as we mentioned, this project we're currently implementing in this academic school year, so through spring of 23. And then from there, this kind of second part of phase 4 is really around toolkit refinement. And so all of the information, feedback, and data that will be and has been collected as part of this project will be used in the future to make revisions and refinements to the toolkit. So we, as a staff and team, we're really interested in understanding, is there feedback or changes that need to take place in terms of the content, right? In those 6 practice areas, are there things that were great, were problematic, didn't work? Were any of the resources that were included or linked, did those need to be updated? We're excited to talk with and learn from the sites around their experiences of toolkit design, layout, and length. So trying to think about kind of what is the practical format? How does this toolkit get packaged? In what ways can we make informed decisions from the pilot data to help strengthen the future version of the toolkit? Beyond just the data from the pilot sites themselves, we're also very interested and excited to have an opportunity to have some expert reviewers, both adults and youth themselves. So young people with LGBTQ identities that have a diversity of lived experience. They are working or serving young people. And so allowing those experts to weigh in on pieces of the toolkit, ask questions, propose revisions, all of that information will be really helpful to us and an important component of this phase 4 refinement. So those expert panels, our teams are starting to assemble those groups and we'll be really leveraging those starting in the spring to help inform future iterations of the toolkit. The last couple points here about the pilot itself. So, there are a number of different anticipated outcomes or things that, we in CDC, as well as the school districts that we're working with, are hopeful will come out or be a result of this project. And so some of those include, providing a comprehensive and practical resource for school districts that are either starting or expanding their LGBT inclusivity across schools. And so, we're very, very much intentionally focused on what is practical, what works, what doesn't work, what is cumbersome, what part of this whole toolkit process was helpful to the school districts. And so really with the goal of creating a practical and translatable materials at the end. The second point I just basically touched on, but what works and what doesn't work. I think one of the things that has been, even in this first several months of working with the school district staff, is really being open and communicating that it's really important to tell us the good things, but it's also really important to tell us what doesn't work or what is a hindrance. And so that we can use all of that really rich data and those really important context clues to help inform the practicality of the tool going forward. And then, an anticipated outcome, certainly, of all of the work that we do here in DASH is that we create and sustain these collaborative and supportive partnerships with the pilot school districts and with the schools that we are working in specifically for this project. So, across the teams, these are kind of really 3 guiding outcomes or goals that we hope to achieve throughout the course of the project. And then just lastly, in terms of time, if you're kind of curious what has happened so far and what will happen. So as we mentioned, we've been working with our 3 school districts since late spring, early summer to conduct the data collection activities. All of our districts are working currently on the district assessment project, or part of the project rather, and creating their action plans, and they will start to do that monthly tracking throughout. And then that will move us all the way through the end of the school year or the spring, to which we'll then follow back up with our post-data collection activities. We'll start to inventory some of those toolkit revisions and begin the data analysis component of the project. One of the things that I think is important and potentially unique about the project is, this is all part of this is also being available to provide technical assistance and support to the school districts that we're working with. And one of the ways in which our teams have kind of conceptualized that is through communities of practice, so COPs. And so the pilot sites are really throughout this whole process going to be able to learn and connect with each other for that peer sharing, really to troubleshoot, what is working in this district, what's working in your district, what barriers are you encountering, and that providing that structured kind of community of practice among the 3 sites is in and of itself a really important support for helping them carry this work forward, obviously through the pilot, but also creating those collaborative relationships that could be sustained even after the project is over. So this is the kind of overview of where Nick and I will be spending our time between now and the end of this academic school year, and are really hopeful for some positive and really great outcomes from the project. And with that, Nick, I'll turn it back to you to highlight a couple of key resources.
Yeah, so we just wanted to kind of take this little last bit of the presentation to highlight some existing resources that we have here at DASH. And so I want to start with the LGBTQ inclusivity in schools self-assessment tool. This was a tool that was developed in the past couple of years, and it's really a resource for all school staff to assess their inclusivity practices across the school environment. This includes sections for individual knowledge, attitudes, and behaviors across all staff types regarding inclusivity, as well as assessments specific to administrative staff, educators, health services staff, regarding different policies, programs, and practices and professional development across those different staff roles. And then on the next slide, we also wanted to highlight the Creating Safe Schools for LGBTQ Youth resource on our website. This is a core competencies for professional development. And so this is really to kind of provide those key learning objectives of inclusivity professional development for school staff. So that school districts can incorporate this and kind of inform their professional development offerings. There are kind of four main pillars to our core competencies, and so those being describing the basics, so understanding definitions of sexual orientation and gender identity, understanding the diversity of identities, and kind of identifying inclusive language, identifying health disparities and the root causes. So that's really speaking to understanding how stigma and discrimination really create stress in adolescents and in people in general, and impact health and behavior across sexual risk, mental health, and violence in particular. We also, another core competency being recognizing the influence of school environments, and this is really to understand the school-based risk and protective factors, kind of where do schools fit in this big picture of adolescent health, LGBTQ health disparities. And then lastly, the implementing supportive practices, policies and practices, and this focusing on kind of how to use inclusive language, what does an inclusive education curricula look like, what are kind of different examples of inclusive policies.
Great. Another important resource to consider, and this one is actually really new, like within the last 6 months new, is our new classroom management approaches to support school connectedness resource. And so we're showing you a screen capture of the page here. And so this product actually came as a result of a systematic literature review that was undertaken by several researchers here in Dash to identify what are those evidence-based approaches that are linked with student connectedness, whether it be to school, to other people in their school, to their teachers, to peers. And from that literature review, there emerged 6 primary domains. And you can see there on the right-hand side, right? Teacher caring and support, peer connection and support, student autonomy and empowerment, managing classroom social dynamics, teacher expectations, and behavioral management. And so this is a really great resource. There are checklists and different layouts of content really designed for the K-12 practitioner. So the educator, maybe a school psychologist or someone that's working directly with students in terms of thinking about what are these evidence-based strategies that are linked with improvements in school connectedness for students, and what that looks like, or how school and classroom environments can be changed or strengthened in order to improve connectedness. And while this resource, is not specifically tailored for students with LGBTQ identities, we do see that across a broad set of evidence that, improvements in school connectedness is important as a protective factor for students. And so we think that understanding and using and applying these management strategies across the school, and really in particularly in the classroom setting, can be or could be beneficial to students with LGBTQ identities. And then the last resource to highlight is the What Works resource. So, we started this presentation with the picture of kind of what is the CDC Dash model. And if you're interested in learning about really more details on the sexual health education piece, the health services piece, or the safe and supportive environments piece, we encourage that you check out the What Works resource. You can see the screen capture here. It goes into much more detail around what is the science, or kind of the evidence of why those 3 strategies, in addition to the a lot more detail about the implementation activities themselves. And so again, if you're just curious to learn more about the program model in general, the What Works resources, I think are a really helpful and important place to start to kind of get a fuller understanding of the program approach. And with that, Emily and others, we will kick it back to you all. And again, just thank you so much for the opportunity to present. And we're excited to hear and answer any questions.
Thank you both so much. That was an amazing presentation. I work with you, but I didn't know a lot of those details and information about the pilot project. So I have a couple of questions, but I'd love to open it up to folks in the room or online first to jump in, especially in case anyone has to hop off right at 1. You can just come off mute or raise your hand, whichever.
Hi.
Oh, Beth. Oh,
Hi, Beth.
go ahead online.
Go, Annie.
I can't see who it was.
I'm sure it was Annie. That's what I think I could hear her voice.
Oh, can you unmute? I think you're unmuted now, Annie.
Can you hear me?
Yes.
All right. Hello. Thank you for such a wonderful presentation on such an important topic. I was wondering if you could speak a bit more to the particular personnel within school systems that you really think should be, folks that you're hoping to focus on in the implementation of this toolkit, and the personnel who would sort of be integral in its implementation at the district level.
Do I have to unmute people now?
Oh, can you hear me now? Okay. I was just messaging like, we can't get off mute. Thank you, Annie, so much for that question. I think that's a super good one. And I can share a little bit about kind of who our districts have recruited thus far to help with the toolkit implementation. So at the district level, our school districts are really interested in using multidisciplinary teams. And so across the 3, they have staff representation, most commonly from school staff in curriculum and instruction, right, that deal with the kind of academic core content curriculum decisions. They have pulled in and leveraged staff from their Title IX and other compliance related departments, given their expertise in compliance policy and understanding and providing perspective around harassment and discrimination or policy issues for sexual orientation and gender identity related issues. We have also seen staff from student health, wellness, health and physical education departments, or other staff across the district that deal specifically with student health issues as being key to these kind of cross district groups. I'll also say that as part of the project, the toolkit teams are working at the district right now in kind of with these different staff and their expertise. There is a phase in the project where then district staff will work closely or directly with school district staff because of what we know about the importance and value of the school level decision makers, right? So principals, assistant principals, counselors, nurses in some instances. So, our district staff teams are first kind of doing this assessment across broadly, then they will leverage and work with the school level teams to really get in more detailed and in the weeds around what does the implementation look like in the particular school, given the staff expertise at the school level. Nick, anything to add about kind of who else might be involved? Oh, and you're on mute.
Okay, I'm back. No, I think you covered it, but I just want to say, like, the toolkit really is a district resource where we're trying to kind of institute this work across the district and really diffuse all this work across all the schools. And so trying to kind of break out of silos, which, is a really big problem that we have in CDC and that school districts have, right? It's just kind of a part of bureaucracies is how to break those silos down. And so I think a lot of it is really trying to pull in just diversity of staff types and staff roles. And so while we do primarily work with district staff on this, and it is up to them who they engage and kind of who gets the different professional development offerings. And, you know, a lot of that is kind of dealt with at higher levels, but we really do try to kind of have this whole school approach to inclusivity is something that, you know, should be fostered across staff types. So more than just teachers, more than just administrators, school nurses, school counselors, psychologists, social workers, bus drivers, cafeteria workers, right? Kind of all of these different staff types are impacting the student experience. And so how can we, you know, bring inclusivity across all the roles?
Oh, thanks for chiming in, Nick, in the chat. I saw your
Yes.
question or your
Yes,
comment,
I was
Erin,
about to-
with NASB. Yeah, that's great.
For those in the room, there was a question about if CDC has worked with NASB, which is the Association of Boards of Education. So different boards of education across the country, and there's student board members there. So that could be a good resource for the
Mhm.
expert panel involving youth in just responding and giving feedback about the toolkit. Beth, did you have a question?
Yeah, I was just wondering if you could speak a little bit about the pilot districts and what the student demographics look like in those districts and sort of size of the district.
Sure.
Did you hear
Go
that?
for it, Nick.
Okay.
Yes. So we're working with 3 districts in the South. One is in North Carolina, one in Kentucky, and one in Texas. And so these districts are all quite different. So our North Carolina district has some racial diversity in their district. And I believe the pilot school that we're working with also kind of has some bigger diversity than some of the other schools within the district. So that's kind of an important piece, right? We're not working across the entire district because we are talking about just a 1-year pilot, trying to kind of learn and develop this resource. So these districts are intentionally focusing their activities on 1 or 2 schools, but it's also kind of building this broader district capacity over time. So as I was saying, this North Carolina school or district has quite a lot of diversity across race and ethnicity, and they've been at the work for a bit. They're kind of a little bit further along, I think, than the other 2 districts, but they're also trying to develop more of an institutionalized approach to this work, whereas right now it's very much a siloed kind of approach. And then our Texas school, they have a quite large population of African-American students. So that kind of gives us a different perspective from the North Carolina school that has kind of this broader diversity. The Texas school district has more representation of African-American students, and they have a really strong history of kind of this diversity, equity, and inclusion work that's going on in schools that's been mostly focused on inclusivity for racial and ethnic minority youth. So they have a really strong history of that kind of work there. And their inclusivity work has been really limited to a few key strategies they've done a lot of work on, but they're looking to expand more. And so that's kind of another interesting way that they're approaching their work. And then our Kentucky school district, mostly white, and kind of more rural environments across their school district. So again, a very different demographic profile from the other 2 districts. And they're much newer to this work. They've been doing some things. And again, they're not totally institutionalized with their work. And so it's just another very kind of different perspective from these 3 school districts and kind of how they approach what their history is and what their student body composition is like.
Any other questions in the room or online? I have a question. So given that this is implemented, you said at the school level, can you explain a bit about what the community of practice looks like, with the intention for it to be sort of more of a broad intervention across a district? Is it just the folks at the school level who are involved in those conversations, or do you have broader representation? Oh, let me, Leigh, I will try to unmute you.
Unmute. Okay, there we go. Yeah, Emily, that's a great question. So the community of practice as kind of one of the supports provided throughout the toolkit project is for the district level teams that are engaged in the work. And so that would include, you know, their staff from the Title IX office and from the Student Health Services and from curriculum and instruction. It could be likely that the district may pull up or pull in these school level decision makers, so principals, assistant principals, etc. But the community of practice is really intended to help connect these district folks across the states as they move through implementation of the toolkit. In full disclosure, we have not had the first community of practice call yet. That's being scheduled in the coming months, and so we'll kind of see who the district chooses to bring to the table for that community of practice. But really, those are intended as spaces where across these 3 school districts, their staff that are engaged in the toolkit can come together, learn from each other, troubleshoot, share, and kind of build that collaborative network. Nick, anything to add about the community of practice?
Yeah, not so much on the community of practice, but really on kind of this distinction between the district and school level activities. So a lot of the focus of this is a district level toolkit. And so, that's kind of looking at policies for the district and how do they kind of implement those across schools. What are the programs that are implemented across the district? What are the professional development offerings through the district? And so that's kind of the main focus. Now, when I kind of talk about focusing on just a couple of schools, of course, this work has to happen in the school for the students to really be exposed to it. And so that's kind of where we're just encouraging districts to work with 1 or 2 schools just to kind of help prioritize their work, because it can be pretty overwhelming to try and tackle, getting a GSA in every school in the district in this 1-year pilot. So that's kind of like the distinction there.
Well, and I see David Page has raised his hand, so I will see if you can unmute.
Yes, thank you. And I'm having trouble with the chat, so sorry to trouble you with unmuting. So I wrote, many students are exploring their gender, sexual identities and may be confused and require confidential professional counseling. How do you provide the space as well as the messaging in school to recognize the transition and the fluidity of their mental processes at that time? Through this process, as well as incorporating external support systems, families, psychologists, camps, religious institutions that they interface with?
Thank you. That's a great question. I think the short answer is a lot of it is, we really do try to provide resource and professional development for school counselors and kind of counseling resources at the school level. But I think another really, and you're kind of bringing this up, another important piece to us at Dash is leveraging parents as resources and kind of as part of this whole process. This is school-based work, but school work doesn't happen without parents in tandem. And so, providing resources for parents on how to support their child, but also just providing resources for schools on how to engage parents in this work, kind of how to bridge that gap. Because the kind of harsh reality is, unfortunately, lots of LGBTQ youth don't have supportive families. So how do we still kind of bring that into the fold or respect that kind of that difference and affirm a student in school sorry, I kind of trailed off there. But yeah, we really do try to kind of provide some resources for the parent engagement and for the school counselor aspect. And as well as kind of providing resources on how to connect to LGBTQ affirming community organizations, kind of areas that are outside of the school when they don't have the capacity to provide those services.
Thank you. Thank you very much.
I see Annie chatted another question. Do you have any plans to track district level policy changes over time as you roll out the toolkits?
That's a great research idea, Annie. Come and join us for the next iteration of this work. I think that the answer is not part of this pilot toolkit, right? Like it's a 1-year pilot. So kind of the feasibility of tracking these longer term district policies is, a little outside of scope. I do think though, when we think about like school health profiles data, for example, right? Like that gives us trends, long multiple year data around some policies around inclusivity. I'll be the first to say that the kind of measures and profiles are somewhat limited around inclusivity, and we're always trying to improve those and increase them to make them more robust and more specific, to kind of drill down even deeper into what does the practice look like, what specifically are schools doing, or in some cases not doing. So I think you bring up a good point, and that is something that I can see longer term, leveraging the data that we have, but also in thinking about this pilot in particular, some of the districts may choose to kind of tackle policy. That may be the focus area that they choose to work on, and whether that means reviewing the current policies that they have, drafting new policies, revising policies. I mean, they're really driving kind of what the work looks like and what their school and community needs at the time that they're in the project right now. But I think longer term, we're always interested in kind of what is the policy implication of inclusivity work in this pilot, of course, in all of the districts that we fund as part of our programmatic work, but also just school districts in general, because we know that right now there is a lot of variation in what state and district policies afford schools to do in the LGBT inclusivity space. So that's a great question, and come to Dash and help us with that.
We have a couple of minutes left. There's one question here in the room.
Yeah, you guys talked a little bit about involving parents, and I think the districts that you chose for the work are really important. But I was kind of wondering, there's been a lot of conversations about parents wanting to have like more of a say in what's going on at schools. And I think LGBTQ youth and transgender youth have really kind of bared the brunt of it. Do you anticipate that affecting the work, or have you already seen the effects of that in your work? Would just be interesting to kind of think about that going forward.
Yeah, short answer, we have seen those effects. There has been pushback, these are things that we are just dealing with as part of this project. There's been pushback at the community level for engaging in this work, for districts even deciding to go down this path to, say we want to support all of our youth. But at the same time, that is a vocal minority. It's really vocal and it's really loud, but it is a minority, and that's what we hear from our district partners, is that by and large, the parents mostly are there to support their youth, to kind of find ways to just help them grow in development and develop normally and kind of happily and healthfully, right? And so there's just kind of this duality where we do see parents sometimes kind of jumping in and being a bit of this roadblock to this inclusivity work. But for the most part, parents are really supportive. That's not the truth for everybody, but that is kind of overall, that's what's going on, regardless of who's louder.
Well, we are just about at time, so we can wrap up here. Thank you all for joining in person and online, and a special thanks to Leigh and Nick for spending your lunch hour with us today amidst all of the other things you have to do. If you have any last words, feel free to jump in if you're able to unmute. But we will definitely see if we can share the slides, and their contact information is on those slides if you have any follow-up questions that we didn't get to today.